guys, what's up? This is Antonio Evans here on BlancaVabuena.com. I wanted to put up a quick video on just some, these analytics on looking at the coronavirus and where the U.S. is and where the world is and whatnot, and the growth and whatnot. So right now we're looking at China's growth right now for the coronavirus, and so if you look at where the U.S. is today, right? And so the U.S. here's the rest of the chart over here. So the U.S. right now has 3,457 as of March 15th. Okay, that's the amount of cases that are out there with about 63 deaths. And if you kind of map that, and I love this site, it's called World Meter Info. It's actually been pretty helpful, just getting the kind of looking at the raw data and just kind of comparing apples to apples. So you see, like, what's the trajectory of the U.S., where are we going, and where is it going to be? And also, I'm going to look at kind of Portugal too. So where we are in the U.S., right? And the U.S., just because that's the market that I care one of the most about, because I'm an American, even though I do live in Portugal. We are, if you look at it, we're around the January 26th number, right? So it's 2,744 in China, okay? And so we're around 3,400, maybe a little higher. So maybe let's go back there and say, so we're around the 26th, 27th. So we're around here. Now on February 3rd is when they put that massive lockdown of the 40 million plus people in the Wuhan province and all the other outlying places to try to stop the outbreak, right? So the amount of days is about, let's see, it's about, I think, 8 days, right? So at day 8, so when they reached that 20,000 cases, they said, nope, putting the brakes on. And that's something that hopefully the U.S. will think intelligently enough and understand that they need to put a brake on at some point of time. And I don't know if the whole belief of American freedoms and all this whole long story that people try to give themselves, that's not a case. The case is you got to put people on lockdown. If not, everyone will get someone else infected, and the numbers will start going out of proportion into levels that are insane. So with that close down, they were able to hold off on the amount of deaths. So let's just put, so 8 days. So if we're in the 15th right now, right? So we're talking somewhere around the 23rd of March. And let's take a look at a map. We need a calendar. So we're the 23rd will put us to 2 Mondays from now, right? So if the U.S. right now gets to where at the same growth rate, we're talking somewhere around the 23rd of March, lockdown would need to happen. Okay. Now, if lockdown doesn't happen around then the number is going to start getting exponentially larger. Okay. And so here's a list of the countries and what numbers that they were at. So right now, Italy's at 24,000. So the U.S. would start seeing deaths starting next week and 2 weeks from now at almost 2,000 deaths. Now, you can say, well, the U.S. healthcare is different and whatnot. One of the big things about being here in Portugal is that, you have a really different view of the healthcare system. The U.S. healthcare system is atrocious. I mean, it's really bad compared to, Portugal, compared to Europe. Like, there's so many times where I, as an entrepreneur, have not gone to the doctor, being sick in my past, because 1, I couldn't afford it. 2, I didn't have health insurance. 3, when I would go, I would sometimes be out of care. I mean, so many different stories. And this idea that, oh, well, health insurance, is now mandated and whatnot. It is, but the thing is, the whole system itself is broken. I mean, doctors are there for making money, right? It's a really bad system, and the whole system needs to be cut off and re-looked and remodeled, most likely towards the European model. It's a way better model. So anyway, so we could say, let's imagine the U.S. healthcare is better than the Italian healthcare. Now, one thing also the U.S. has is the age group in Italy is a lot older. Same thing in Portugal. And we'll look at Portugal in 2 seconds. So with an older age demographic, you have a lot more people susceptible to this disease. So yes, U.S. may bode better, but right now statistically, we're pretty much on par. Like, we are pretty much on par with France, right? Like, if you look at the numbers of deaths, we're about the same, right? New cases, they're holding them back right now, but that would be the question of self-reporting too. So let's talk real quick about Portugal. So down here, scroll down a little bit, right behind Czechia is Portugal, And so Portugal is at 245. Okay, now we're a way smaller country and we're a way older country, older population. Also, we're probably as old as Italy. I'm not exactly sure, but somewhere I heard where like the average age of the major cities like 65. And trust me, there's a lot of older people here. And in my walking around, there are a lot of people who are coughing, right? Like I don't walk around, I only take the dog out to do his thing or whatever, but it's been a while where people are sick now. People, the streets are a lot more empty, like way, way, way more empty. I would say like 80% of the people are inside. People are definitely doing the right thing here in Portugal. So if when the country mandates that we go into quarantine, I think the Portuguese will accept it, and it'll just come and pass that 1 month of crap. Where everyone's kind of locked up at home and wanting to kill each other and having to read a lot of books and play video games and do whatever the heck you want to do at home. But then after that, we'll be fine. But the Portuguese are doing the right thing about it. But we want to look at where the Portuguese are. So at 253, remember, we're only a population of about 11 million, 10.5 million people. So not a huge population. So as you start looking at it, you want to look at the cases per, per 1 million users and 1 million people. So we're not doing like Japan. We're not doing like anybody over there. We're pretty much doing it. Our numbers are pretty much on par of where we should be at this time, but it's going to start getting exponentially higher, right? And so if we put ourselves again, so let's see, 245, right? And if you look at China, you really can't even map it on 245, just how the cases are reported on the site. But let's assume that we're going to be about a week or a little less than a week below on the 22nd of January. So we're gonna start seeing over here numbers, in a week from now, jumping to the 500, and then a couple days after into the thousands, right? And that, remember, our population is quite small, so that's why quarantine needs to be put in place. So, I mean, just with that, the idea of quarantine, like, when's the best time, when's not the best time, you need to get a couple people infected so that, some people can recover and so that we're not overloading the system. That 20,000 number is great for a country the size of the U.S. Maybe, hopefully, that's a number where is acceptable, where we can start putting that in. At Portugal, the number is going to be, I would say, in the thousand or less than 1,000. So we're talking next week. So if today's March 15th, I would not be too shocked at seeing something like, somewhere here, maybe the 23rd or maybe the end of the week when the announcement will be made when quarantine needs to happen. So yeah, that's a little it's scary, it's spooky, but it's doable. I mean, what's great is if you look at the recovery of China, and once you've closed off, the people, I mean, once you closed off the amount of people who can get affected, the numbers start flipping. So here we go. So January 3rd, they put it in place. Numbers rose for a little, then they started dropping, and then as they started noticing more cases, and this one was a major amount of cases that have been reported. China, they don't love to report things as clear, but the numbers dropped down. So, and then now the recoveries overmatch the amount of new cases, and they've stayed that way. And that's the key. The key is to make sure we don't overwhelm the hospitals, because there's still people who are sick of other things that need to be in the hospital. We have children who get normal illnesses. You got people who break arms. You got people who have cancer. People who have AIDS. People who have other diseases out there that need to have hospital services. People just taking blood, So we don't want to overload them. But in order to find that right balance, I would definitely say that next week, I would definitely say that the target date for next week would be somewhere maybe the 23rd of March. I think that would be a good time for quarantine to kind of hit through the whole Western world. And then let's just close up for the month. March is off, right? We're done. The week after, let's say, Easter or something like that, people come back. And then suddenly business as usual. It's tear the Band-Aid off right now for the long-term pain. I hope people follow this, and I hope the U.S. follows it. I hope the U.S. president listens and understands that this needs to happen. It can't just happen in local areas. We can't just have Washington State close off and then New York close off. The idea that could work as long as those populances are not moving. And how the U.S. is, people do move between populances. So, if people come from, Washington State, but they really live in Omaha or whatnot, and they move to Omaha and then they get a couple people sick, or, one church group goes from one place to another place and they get infected. Again, that's the movement of it all. So we need to think in that scale in the U.S. So definitely quarantine in local areas to start with, But there might have to be a massive close down of the country, and maybe that's what you do. You just close certain cities, right? You close the Washingtons, you close parts of New York, you close parts of DC, and then you do a curfew, and you make sure that people aren't out, and you make sure that supermarkets kind of follow like where they're doing, where one person goes in and another person goes out. Just make it so that people move less, and when people move less, the fingers are crossed that'll happen, that it won't overload our healthcare system. Because if we let it go as a wildfire, we're going to see millions infected. And when we have millions infected, or even if hundreds of thousands infected, and we haven't had a quarantine in place, we're going to see death rates that are going to be in the hundreds of thousands of people. And we don't want that. And it'll be of older people and sick people, and that would be a horror. So let's hope that we put a quarantine in place, hopefully by next week, to begin saving lives and make sure that our healthcare system isn't overloaded. All right, this is Antonio here from Social Draft and Friends Eat and whatnot. So if you guys want to reach out to me, or if you have opinions on this, you can definitely comment down below in the blog post. But yeah, that's my 2 cents.